Everybody, today's show is all about how to do a whole bunch of different things. And right now we're going to talk about how to live with pain, treat pain, and maybe not have it in the first place. And joining me to talk a little bit about that is Dr. Doug Gateman with the Aascend Pain Institute in Appleton. He brought along one of his colleagues. Good morning. Good morning.
Good morning.
So who is with us today?
This is Dr. Randy Blahoviak. He's a chiropractor we work with quite often. He's come today to talk about what they do for preventative measures, how they treat chronic pain, as well as what we do, how they work in it together.
So you brought along a couple of props. Let's start out with first, let's talk a little bit about arthritis.
Okay. The big thing is for arthritis, when people have it, they understand that's pretty much the joint's worn out. It's wearing out. So it gets inflamed. So the easiest thing for most people is before you go do something, take some ibuprofen. That way the joint doesn't swell up worse. Some people can't take ibuprofen because their stomach hurts. So what I brought with us today is different modalities, what we do, different things. This is a gel you rub onto a knee or joints and hands, great for typing. It just soaks in. Doesn't have the side effects of the stomach. This is similar. This is actually a drop. It's not a gel, so it's very similar. And this is actually a patch people pull on. It looks like the numbing patch a lot of docs get, but this is actually anti-inflammatory. It's they put on their back and just sit there and run it for 12 hours and just soaks in one area.
Really?
Very low overall body exposure to it, so you don't get the side effects as much. So it's much safer.
Is all this stuff over the counter, or do you need prescription?
These are prescription.
Okay.
So yeah, this is prescription stuff. But once again, this is stuff you do before you start working out.
Got it.
And so, and a lot of stuff we do as well is we just calm it down. And we'll let Dr. Blahoviak talk about what he does for his patients that are help prevent arthritis and keep it under control as well.
Yeah, first of all, the key is, as Dr. Doug said, arthritis is things wearing out. And things wear out because they don't work right. So what we do preventatively is we try to make sure that the joint is functioning properly. If that means movement, or if that means calming down the spasm, whatever it means, we try to address that appropriately. Once it has started to wear out, we do definitely encourage patients to use those sort of means that Dr. Doug employs in his clinic.
But, you know, people who have it, doesn't mean they have to stop living. You know what I mean? There's things that you can do. There's, you know, I think a lot of people get this pain and they're like, it's over. You know, and that's what you guys are all about. It's not over.
Correct. When I tell people all the time, we bring pain down. We don't make it go away, but we also bring your function up. So you got to do more, and that's how the physical therapy and the chiropractic work well, because they keep you moving, and we try to keep the pain down with what they do as well. So the combination works really well. And another thing I brought today was the bone samples we have for osteoporosis. Just as people don't really realize, when this is normal bone, this is the outside, but the osteoporosis actually is thinning of the bone, and you can see how thin this gets. And that's why people have fractures.
Okay.
So preventive medicine, eating well, if they put you on medication, you got to take the medication.
Okay.
And if it gets thin, there's other medications you can take to actually get the bone back to where it was. But preventive medicine is huge in our world, just to keep people moving. And you want to keep moving. Right.
We come so far in that, you know, things that we didn't know about. And for people with osteoporosis, how can you help?
Well, the key is movement. You know, exercise and weight-bearing exercise especially is what prevents osteoporosis from occurring. So if you want to get or not get to the point where your bones are thinning, you need to exercise, do the weight-bearing, and that's all dependent on movement, and Dr. Doug and some of his pain relief therapies can continue to keep you that way.
I tell you, a bottom line is that people that are, you know, don't want to get out of bed any morning and suffering from pain might not need to. There's so many different things out there, from, you know, chiropractors to Dr. Gateman, and it's amazing. You know, ask for help, and there's so many new things out there.
Exactly.
And it doesn't always have to involve surgery either. So.
Oh yes.
All right. Thanks, guys. Great to see you. Appreciate it.
Thank you.